Hey, welcome to Facebook Live. This is Dr. Bill Bird. I'm the Chief Medical Officer at CGH Medical Center, and thanks for taking some time to join our broadcast. As always, during this broadcast, send in your questions that you have, and I'll try my best to either answer them or try to find an answer afterward and bring it back next week. So, format this week will be like we did last week. I'll give you some facts that I'm aware of about the pandemic. Any news that's ongoing, I'll speak to that, give that information. We'll talk about any questions that are still out there, and there are a lot about COVID. And then finally, I'll give you some just analysis of the information and recommendations. So, with no further ado, let's start with the facts. Matt's going to put up some graphs for us. Okay, this is what we put up every week. This is for Whiteside County, our weekly update. And as always, the top left corner there is in red are the infections this past week, and in blue are the infections the week before that. And then the bottom left are infections the past 2 weeks, and the blue are the number of infections the 2 weeks prior to that. So the top one's more of a 2-week snapshot. The bottom graph is more of a 1-month snapshot. And then on the graph on the right, you see the percent positive rate. And then just kind of a trend, you can see, I think that I don't have my glasses on the left there, but I think that goes back into like January or so in terms of our daily case counts. You can kind of see the numbers over time. The second graph I will show you is yesterday's numbers, number of cases we had, positivity rate, just to give you some sense of that. The next one I'm going to show you is, let me pull my glasses over here too. So the blue are the number of cases in Whiteside County in June. The orange, I think the color is orange, are the number of cases in July, and then yellow are the number of cases in August. So obviously that fits with what we're seeing in terms of the surge. And then you can also see they break that out based upon age group, and you can see obviously a trend in the, let's say, under 60 crowd in terms of the cases that we were seeing, have been seeing. So I thought that was a good graph to show you all today. Thanks, Matt. Some more facts. In Illinois yesterday, 5,178 new cases. That was the first time our state went above 5,000 cases since January 23rd of 2021. In the U.S. yesterday, we were averaging 149,000 cases per day for the past week. And in the U.S., I didn't get an official count, but I looked back in my records, and it looks like we're averaging somewhere around 1,000 or more deaths a day in the U.S. in the past week. There were, what else did I want to show you? Oh, yeah. So yesterday, there were 2,242 hospitalized patients in Illinois with COVID. There were 512 of those who were in ICU beds and 283 who were on ventilators. Compare that to what I found as the lowest ones in my records on July 1st, so about 2 months ago. Rather than 2,242 hospitalized patients, there were 405. Rather than 512 ICU patients, there were 84. And rather than 283 patients on ventilators, there were 34. Big difference. On July 1st in the U.S., there were only 14,000 cases reported and 231 deaths. I got some information. I know we're not in Iowa, but I just happened to, someone sent this my way from Iowa, and sounds like their Department of Public Health. So for their hospitalizations, They have about an 80-20 ratio right now. So 80% of the hospitalized patients are unvaccinated and 20% are vaccinated. And in their ICUs, 88% of the patients in ICU beds are unvaccinated and 12% are vaccinated. In terms of vaccines, in Illinois, this past week we've been averaging 39,922 vaccines per day. In Illinois, for those over the age of 12, 59.7% are fully vaccinated and 76.9% have at least one vaccine. In the US in mid-July, there were 500,000 vaccinations a day being given. As of 8/31, there were 900,000 vaccinations a day being given. That's an 80% increase. So that's good. In terms of anaphylaxis, I was looking this up, anaphylaxis from vaccines. I looked at one from Journal American Medical Association, which is one of our most well-known journals. This was a Moderna study, 2.5. The rate was 2.5 anaphylaxis episodes per million shots. This was a March 8th one, but I think that holds. And at least in that study, no one died, but people had to be treated for that. So once again, good in terms of that. Long-term side effect wise, I know that's something that's an issue. Fact wise on that, when you look that up, for vaccines, going back in time, that tends to be about a 6-week window. We're now more than a year out from the original folks who started the trials for Pfizer and Moderna, and there are no long-term side effects yet identified. Also, some information on vaccination, just a Kentucky study that was done. And those who were people that had previously had COVID, who were unvaccinated, were 2.34 times more likely to get sick than patients who had been vaccinated, even though they previously had the infection. I thought this was a good week to talk about some vaccine historical facts and just some information from public health that I found interesting, and I hope you do as well. So in 1900, the average life expectancy in the United States was 47.3 years. Community-acquired pneumonia, influenza, tuberculosis, diphtheria, smallpox, which, by the way, killed 300 million people in the 20th century alone, smallpox, typhoid, they were the leading causes of death in 1900. And they tended to be more so for those under the age of 20. Combination of vaccination, sanitation, and antibiotics all played an essential role in limiting mortality from infectious diseases. So, matter of fact, right now, I think it's heart disease, then cancer, then strokes. Basically, what I'm trying to say is, it may flip one of those here, maybe cancer nowadays. But anyhow, my point is that now non-communicable diseases, so not infectious diseases, are the primary causes of death in our country now versus over 100 years ago. And those three things, vaccination, sanitation, antibiotics, played a very large role in that. From 1970 to 2010, 1970 wasn't that long, 51 years ago, to 2010, life expectancy, I think this is in the world. I don't think it's just in the US, but I can't remember. I wrote this all down this morning. I'm regurgitating it. Increased from 58.5 years to 70 years. Which I just found fascinating and encouraging in that regard. There's something called the Global Alliance for Vaccines and Immunizations of Infants that kind of really kicked off in 1970. And during that period of time, infant immunizations in the world went up from about 5% to 90%. As a result of that, the World Health Organization estimates, you could give or take a few 100,000 on this, but it's still pretty impressive, that 2.5 million deaths annually are prevented because of vaccinations. That's 5 deaths a second. Yeah, so obviously some very, yeah, those are the facts. That's a lot of parents, grandparents, great-grandparents that were able to make it to adulthood because of vaccination, sanitation, and antibiotics. There are other things too, but those were the big players. Okay, so that's some facts. Okay, here's a previewer question. When breakthrough cases occur, individuals surveyed on which vaccine they got. If so, which is showing the strongest protection? I don't think everyone is surveyed to answer your question. I do think that though the trend is that you were to look at the most effective vaccines, it would probably right now be Moderna, then Pfizer, then J&J, to answer your question. All right, so news, a little bit, this week, not as much in the way of news. All of the folks that fall under the governor's mandate are definitely gearing up for the September 5th, where folks need to be either fully vaccinated or be tested every week. And here at the hospital, we are, that's ongoing right now to get that up and going. So that is the news that I wanted to share for this week. So questions, always questions, right? When will vaccines, I've had this asked of me this week more than once. When will vaccinations, maskings, social distancing end? How much of this surge is related to the Delta variant versus waning natural or vaccine immunity? Will the third shot be recommended for everyone or just those who are in certain risk categories? What will COVID look like in 6 months, 1 year, and 5 years? Once again, those are questions. I'm not giving answers. I think that's going to play out in terms of some of those questions, but they are definitely questions that folks in the scientific community are working on and doing studies on and trying to figure that all out. So, and by the way, I did have, now I'm kind of getting into some analysis and recommendations. I did have one. What are your feelings on flying now if vaccinated? Yeah, so the actual, what I'm reading, being in the plane itself is, as long as everyone's wearing a mask, that's pretty reasonable. That's fairly safe. It's safe. There's always exceptions to that, Donna. But actually, flying in the plane is pretty safe because of how they do what they do with their air handling. I think the thing where if you're traveling, just is really to be probably more aware as you go into the airport and spend time in the terminals, and then, of course, as you leave the airport and spend time in places you're going to be at, such as restaurant, hotels, and those kind of things, to make sure that you do things that would keep you safe in those situations. So the plane itself, not too bad. Things around it, a little more careful. Not that you can't travel, but you just have to be smart about it. Okay, so getting back to that, I had a question that popped up, and we're gonna send out some more information about this. But in general, it was a long question, but it was about the Pfizer vaccine, and still not officially FDA approved. Yeah, I'm pretty sure it's FDA approved, at least for 18 plus. And some questions about the formulation of the shot and what's in the shot. And first of all, I'm pretty sure that the FDA puts that, or there's in the product information on those shots, what's in that shot is in that formulation. but we'll send information out to this viewer so they can get some information that we have about that. And also say that the FDA, they're going to be, gosh, I think they're going to be pretty careful about checking what's in these products and making sure that they're safe for the public to use, particularly now that we're out over a year. The longer we go and we see that the vaccines are working and we're not seeing any serious repercussions from them, the more comfortable I think the FDA feels, and I feel in terms of the vaccines. And I think, I think that was kind of the main gist of that question. So we'll get some information about that to that viewer, but I feel like it's been approved by Pfizer for 18 plus. Moderna's still in process. The ingredients in the shots, I don't think are mysteries. I'll look into that a little bit myself. But that's my answer to the question for now. Let's see here. Will hospitals still treat unvaccinated people for things other than COVID? Oh yeah, you bet. That's our mission. And so if folks are unvaccinated, we don't, when they come in, we ask, of course, that everyone who shows up and gets care here follows the safety protocols that we have in place. And I think that coupled with what we're trying to do on our end, and even now what the governor is adding that we're going to be doing on our end, should make when you go into a hospital or a clinic, one of the safer places you can go into, whether you're vaccinated or unvaccinated at this moment. Thanks for the question, though. So I think the thing I just wanted to, my analysis of all this is that, first of all, and there aren't many, so here's the thing that I would say in terms of, I'm comfortable saying with pretty high degree of certainty. And that is that the vaccines that we have, they do work. And based upon some of the facts I shared, vaccines have worked and been very effective for over 100 years. The vaccines decrease infections, they decrease hospitalizations, and they decrease deaths. The other thing I'm very comfortable in saying is the vaccines for COVID are safe, way safer than getting COVID. You think about COVID, and right now we're seeing 1,000 deaths a day in the country. And, depending on what source you read, I was seeing around 10% of patients have long-term COVID or long COVID issues. And I'm really comfortable that we're not seeing that in our vaccines. So vaccines are safe. And also that when you wear a mask when you're indoors in a public place, and you try to distance yourself when you're indoors in a public place as much as you can, that also is going to reduce infections as well. I'm also pretty comfortable in saying that, those in the public health field, those in the medical field are working hard to try to balance, trying to reduce disease, death, and overwhelming the health system with trying to give people as much personal choice and freedom as we can. Now, my opinion is, and I'm more comfortable falling in the camp of erring on the side of decreasing that disease, death, and overwhelming hospitals at least for now, just given where we're at in terms of this point in our pandemic and with this Delta surge going on. What do I hope? First of all, I know that we're going to get through this pandemic. Every pandemic has had an end. And so I'm hoping that is sooner rather than later. That's for sure. And I'm hoping that we can get through this and with as minimal amount of disease and death as possible. And, you read about this, and I hope that at the worst, at some point in time, COVID becomes more like an influenza, where, influenza is not something that is, in a typical flu season, you're going to see between 12 and 60,000 people that would die from influenza. And, if we could get COVID down into that range, that is still not, it's not great that you have those people that are passing away from an infectious disease, but it's way better and way more manageable than our current numbers are. So those are my facts, news, questions, and some analysis. And just my recommendations continue to be the same thing. Please get vaccinated. Wear a mask when you're in public places and you're indoors. And try your best to social distance when you're in public places and you're indoors as well. Stephanie had a question. Should people get the antibody test before getting vaccinated? You may have already have high antibodies built up. Yeah, good question, Stephanie. I kind of alluded to this in that Kentucky study that I found today. And in that study, even for folks who have antibodies, and by that I'm going to say that anyone who has antibodies and it wasn't because of vaccination has antibodies because they had the infection at some point in time. Even those folks who have had a previous COVID infection, the likelihood of getting sick was increased by 2.34. There was 2.34 times more likely of getting sick if you had the vaccine versus if you didn't have the vaccine, even if you'd previously had COVID. Now it didn't go into, of those folks, how many were hospitalized or died. So you kind of have to, I guess, decide for yourself there, Stephanie, if, obviously there's a little bit higher risk of getting sick if you're not vaccinated, even if you've had COVID. But obviously you do have some immunity. You definitely do if you've had the infection before. We're still trying to figure all that out. I saw a study on this shingle shot if you're over 70. Okay, I'll get to that one, Donna. But as far as there's definitely some data flowing in there about, I know that right now the recommendations are 2 shots if you've had COVID already. I over time we'll kind of figure that all out more. I don't think 2 shots is going to hurt you. There are some studies out there that suggest 1 shot gives you a pretty good bounce in your immunity if you've had COVID before. But that's all getting sorted out. That falls under my questions bucket still. Donna had a question about shingles. What was that again? Can you throw that up there? What are your feelings on the shingles shot if you're over 40? I am very supportive of that shingles shot. Matter of fact, I'm supportive of that shingles shot if you're over 50. Because if you're over 50, you can get it. You can get the shingles shot. So yeah, shingles shot has been really helpful in reducing the cases of shingles. Now, it doesn't fall in that bucket that, like I was talking about at the beginning in 1900, of those childhood diseases that, we have chickenpox that we've done a good job of cutting back on with the vaccines. But what I'm saying is that the shot helps you just from getting shingles, because as we know, shingles is just what I used to tell patients. Shingles is just chicken pox coming back to haunt you. Because chicken pox, when you get it, doesn't go away. It lies dormant in your spine, in your nerve roots of your spine. And then for different reasons, stress, infection, your immune system is not as strong. All of a sudden, it'll flare up in one nerve root. And that's when shingles flare. So it's basically just chicken pox coming back again. So yeah, I get the shot, you bet, Donna. Other questions from our viewers today? Going once, going twice. Okay. Well, I thank you for those of you who took the time to listen. I encourage you to share this broadcast with those that you know. And I hope as I come to you with this broadcast, I'm coming to you with as much information as I have, and I'm trying to share it with you in a format that is as transparent as possible. And I'm not trying to be the be-all, end-all of COVID information, but the things that I feel really comfortable with, I am sharing those with you, and I hope that hearing those things are helpful for you as you think about navigating this pandemic in the weeks and hopefully not too many more months to come. So until next week, when I'll be back and we'll share some more information. Thanks for listening. Have a great week and have a safe week. Thanks.